I'm going to draw the trapezius in. It's, as we've said before, it's the big coat hanger muscle. So what I feel for is, here's a bump, which is the end of the this is the end of the clavicle, and it joins into the acromion, which is and we'll start just here. The acromion is a rounded bone which then runs into the spine of the scapula, ending there. The scapula does this, which I'll just draw. That's how the scapula goes. And the clavicle carries on here. Now, the trapezius muscle arises from the lateral third of the clavicle, so it's in the front. It attaches all the way around here and along the spine of the scapula, like that, all the way to here. It then runs across, it runs up like this, running straight up and attaching into the base of the skull. It runs straight across like that and attaches into the dorsal spines of the neck down to T3. So we come around like that. So it's this huge muscle, and the truth is that this is only the upper part of the trapezius, but it's by far the most important part of the trapezius muscle. The trapezius muscle has two trigger points. The first, if I turn you around, is halfway between the end of the shoulder and the beginning of the neck, and it sits just here. And this is the most common trigger point in the human body, as we've discussed before. And the second trigger is just where it's just where your shoulder and your neck join here. This is when you treat yourself. You take your opposite hand, your finger goes over, and your thumb tucks in under. So the finger pulls, that's nice, you've got that. So his fingers have pulled the muscle onto his thumb, rolled it up. And now, once you have it, then the beauty here is that you'll know just how hard to push to make it sore, then reduce the pressure very slightly until you're below the pain threshold, follow the ischemic pain principles,